Hi guys, my name is Susan. In this video, I am about to tell you about what I went through on my liver transplant. I was diagnosed 7 years ago of liver failure, and as of August 19, 2024, I received a call stating that they have a liver for me and if I wanted it. And I said, of course I want it. And they told me to get to the hospital by 5 o'clock. So I had to rush and pack up some stuff to go to the hospital. So my husband and I went to the hospital. They admit me, and they had to put, it was for a post-op operation starting the next day. So they put all these IVs and did some tests and getting me prepped up for surgery the next day. So I was kind of scared because of, you get all those scaring thoughts of everybody saying all this and all that, and it was in your mind. But it made me calm down because it's like I've waited 7 years for the transplant. So the next day they got me ready. It was a process because I hate needles. And so they put this IV in my vein, and they said my vein was really small, and they're putting it right here on my arm. And somehow it wasn't going in. The one of the nurse or technician or somebody was putting it in, but it was hurting. So I told my doctor about it, and they said, well, once you go under, we'll put it somewhere else, because it was uncomfortable and it wasn't in there the right way. So I was shaking because it was time for me to go into the operating room. I said goodbye to my husband just to, and all I remember was they told me to get on the bed, the surgery bed, and next thing I know is I was out. From what my understanding is, it took them 10 hours to do my surgery, and I woke up in the ICU recovery room, in my own room that they put me in before. And it was just, I was in a daze, and it was just, and I woke up and it was like, okay, it was in the evening time. I wanted my husband there when I was waking up, but he wasn't because the visiting hours were done. So I saw him the next day, and it was happy to see him, but then it was like I was hurting, and it was just the nurses coming in and out all the time, like every 2 hours. You can't really sleep, and so it was hard sleeping on that bed. But all in all, it was they wanted me to get up, move around, and trying to get out of the ICU and go into the upstairs recovery room. And so it took me like maybe a day to get out of the bed, sit on the chair. They wanted me to sit on this chair for the whole day, and then go back into the bed. And then the next day they had the physical therapy come and help me walk. Because of that, they cut the muscles to get to the liver, so I was all stitched up and stapled up to where it was like I couldn't move much, and I had a band around my incisions around my body to keep it in place. So I was determined to get upstairs because I didn't want to stay stuck in the ICU and everything, because then it would take me longer for me to get out of the hospital. So I did the little exercise they wanted me to do. They wanted me to push the shopping cart they had in the hospital and try and walk around the hospital, which I did. And then they told me that I was going to be discharged from the ICU to go into my regular room. So I went there and it was good, but then I had to do the physical therapy, which I was doing good of, and then it was like they were constantly coming in giving me my medicine, which was like, to me, I felt like I was taking 20 pills, and then they had to give me some insulin and all that. It was just, it was hard, but I got it through, because now in my mind I'm saying that I'm glad that I'm alive, because that, what really scared me was dying on the table. But I'm glad I'm here to tell you guys my story. And it was hard being in the hospital, because you're not used to being in there for 7 or 8 days. I was in there for 10 days. And then when they told me to be discharged, it just hit me, and I was scared to go home without the care. But I got used to it, and then and when you get discharged, they tell you about all these medications you have to take, and make sure you take them. It was just like, they put like a whole book right there in that one session of you getting discharged, and it's like, okay, I'm hoping I can remember all this, but I had the paperwork. They told me when to take it and everything. So I got home, and it was like a bumpy ride, but all in all, they were good. The doctors were good at my surgery. My surgeon was good. And I am, to this day, after 3 months later, I am moving around more and more, and I'm not wearing my my belt around me. Only when I go out, because that's when it hurts. I still have the incision, and it's hurt, and it goes from, they cut you from right in between your breast, chest area, and then they go maybe 4 inches to your left, and then all the way around on your right side where the liver is. And it took, I would say, about 2 weeks before they, no, I would say about 2 or 3 weeks, they took my staples out. And it felt good having it out. So, but once you get out, you have to take these medicines, for some of these medicines, for the rest of your life. And it's just be prepared for what to expect if you're having a liver failure, or the doctor's telling you that you're going into a liver transplant. But you're going to be on a list on the transplant. So if you'd like to hear more about my story, please comment below, hit like and share. And that's my story of how to expect a liver transplant. Bye.